everyone, welcome back to my channel. My name is Chelsea. I'm a physical therapist with Renew Physical Therapy in Bentonville, Arkansas, and I specialize in pelvic floor or pelvic health physical therapy. And in today's video, we're going to talk about pelvic organ prolapse. So this is number 3 in a series of videos that I am making about the top reasons to see a physical therapist. So if you've been diagnosed with prolapse or you suspect that you have prolapse, keep watching this video to find out more about treatment for prolapse with physical therapy. First, we'll just review the pelvic anatomy. So this is your pelvis. This would be the front, your pubic bones here, your sacrum and your tailbone back here. This is your spine. So when we talk about your pelvic organs, we're talking about the bladder, the uterus in females, and the rectum. And so they normally sit down in this pelvic cavity all nice and supported. They've got ligaments and other tissues that hold them up, as well as this big group of muscles here that provide support. So what happens whenever you have pelvic organ prolapse, one or more of these organs start to fall into the pelvic cavity and then end up putting pressure through this vaginal opening here. So depending on the degree of the prolapse, it can either be visible inside the vaginal opening and feel like pressure and heaviness, or if it's severe enough, it might actually extend outside of the vaginal opening. And so it's not actually your organ itself that is poking through, it's basically pressing on the wall of the vagina and causing that wall to kind of fall down and out the opening. There are several different types of prolapse. The first one is called a cystocele or an anterior wall prolapse, and that is when the bladder drops and the bladder is affected. You may notice increasing urinary symptoms like leakage or even difficulty emptying the bladder. The next kind is uterine prolapse, and so that is when the uterus itself starts to slip down and starts to come, pushing into the vagina and starts coming through the vagina here. The uterus is supported by several ligaments that can get overstretched during pregnancy, and that can lead to that uterine prolapse. You can also have a what's called a rectocele or a posterior vaginal wall prolapse, and that is going to be when the rectum starts to push down through that back vaginal wall. With a rectocele, you might feel things like constipation, difficulty emptying your bowels, straining to empty your bowels, feeling like you don't completely empty your bowels. There are also different types of prolapse. There's an enterocele, that's when the small bowel actually prolapses, and then also a vaginal vault prolapse, and that would be someone who has had a hysterectomy or a surgery to remove the uterus, and what's left of the vagina, the top part of the vagina, starts to fall down into the vaginal canal. So several different types of prolapse. You can have one or all of these prolapses. It just depends on your body. Prolapse can be a scary diagnosis when you first hear it. If you feel like your organs are falling out or you feel like everything is heavy and falling out. Some women, have this feeling of heaviness and they're not exactly sure why. And then they do get a diagnosis of prolapse, and it can be very confusing and distressing and uncomfortable. So our goal in pelvic physical therapy is to not only provide treatment for the prolapse, but also give you plenty of education so you can feel empowered to help manage the prolapse. It's definitely a manageable condition and highly treatable condition, especially in the lesser grades of prolapse. The less severe cases can have absolutely great results. It's also estimated that 1 in 5 women experiences prolapse at some time throughout the lifespan, and I would guess that it's probably even more common than that. A lot of times people just don't like to talk about these conditions. They can be embarrassing, they can be very stressful, and there can just be a lot of misinformation or even just like no information about what women are dealing with. And so I would imagine that someone who has a prolapse, or you may even have prolapse yourself if you're watching this video. So of course we want to give you hope that there is treatment and that it is a common condition and that there's no shame in having this condition and that it can be treated. Next, we're going to talk about some common causes of prolapse. So one of the most common causes is a vaginal birth. So a vaginal birth, obviously pregnancy in general, puts a ton of pressure on the tissues and the muscles that support your pelvic organs. And whenever you have that vaginal birth, those pelvic floor muscles go through a huge excursion. So they are stretching absolutely to the max. So after the baby is delivered, those muscles don't immediately go back to the support that they once had. So that can lead to issues where you don't have that support from below, and those organs start to move and start to fall and put pressure. Another aspect that could lead to pelvic organ prolapse is delivering a large baby. So research has shown that if the baby is over 8.5 pounds, you're more likely to have prolapse. And that's just because, again, you're getting that intense amount of pressure going through those vaginal muscles, the pelvic floor, and all the ligaments and tissues that help support your organs. So having a big baby vaginally can be a risk factor for developing a prolapse. Another risk factor for prolapse is chronic strain through the abdomen or chronic increase in abdominal pressure. So this would be somebody who has a chronic cough. So whether they have COPD or another lung condition that causes constant coughing. Smokers sometimes, they get the smoker's cough. That constant pressure down through the pelvic floor can over time weaken the tissues and weaken the muscles and lead to less support and lead to the pelvic organ prolapse. Another factor that goes along with that constant strain or pressure is chronic constipation. So if you are someone who chronically strains to have a bowel movement, every bowel movement you have, you feel like you are really bearing down, putting pressure through your pelvic floor, through your stomach, that can over time weaken the muscles as well and weaken the tissues and lead to prolapse. Chronic constipation you see a lot of times in erectocele, so that back vaginal wall prolapsing or the rectum coming down and pushing on the vaginal wall. That is common with constipation. As you age, you naturally lose muscle tone, integrity of your tissue, and so that kind of sets you up for the possibility to develop a prolapse. Another thing that goes along with aging is menopause. So whenever the hormonal shifts occur in menopause, the vaginal tissues shrink, they become drier and just less pliable and flexible overall. That's going to lead to less support of those pelvic organs and could potentially set you up for having a prolapse or having prolapse symptoms. Two more risk factors for developing pelvic organ prolapse include family history. So if your mom or grandma or sister has prolapse, there might be some genetic connection. And another one can be, speaking of genetics, a connective tissue disorder can sometimes lead to prolapse. Ehlers-Danlos syndrome is not necessarily a common condition, but it is widely talked about in connective tissue disorders. And so if somebody with EDS, Ehlers-Danlos syndrome, that can lead to prolapse, because that's basically a connective tissue disorder that causes a lot of stretchiness within the ligaments. And there can be women who have never had, childbirth and that are young that can have prolapse because of this connective tissue disorder. So that's just something to watch out for and think about. There's also even like online tests that you can do to assess yourself for general hypermobility. And so not necessarily to diagnose yourself with a connective tissue disorder, but there's simple assessments that you can do. And maybe I can make a video about that too, kind of walking you through how to assess to see if you have hypermobility. It's called the Baton scale, if you want to look that up. But anyway, knowing if you have a lot of hypermobility in your joints might help you, kind of determine if you do have some of these risk factors. When you're coming in for a physical therapy appointment with a diagnosis of prolapse, we will kind of walk you through what we expect the course of treatment to be. Your PT will help walk you through that. So on the first visit, we'll take a really detailed history. We want to know about your childbirth history, if you have any chronic constipation, if you're a smoker, if you have a chronic cough. All these things can help kind of clue us in to what could be going on with that prolapse. After that, we can take a really detailed exam. So we'll look at how your body moves. Do you have lower back pain? Are you able to, bend and lift? Do you breathe whenever you're bending and lifting? Do you move around well with good stability? After we look at that, we can also check your pelvic floor strength and check for that laxity or that movement that you may get in the walls of the vagina. So we can do that internally. We're just looking at your pelvic floor muscles to see how they respond under stress. We may also ask you to gently bear down so we can kind of visualize that prolapse to see if we see some movement in those vaginal walls whenever you're putting it under stress. If you don't really have any symptoms in lying down, a lot of times people who have prolapse feel great whenever they're lying down, but it's more when they get up and move around, or they're carrying their kids, or carrying heavy boxes, or standing all day. That's when they really feel it. Please feel free to tell your therapist, hey, I don't feel it whenever I'm laying down, but every time I stand up, that's when I feel the pressure. We can absolutely check you whenever you are standing, when you're doing a lunge, a squat, really any position that you feel like causes the symptoms. We would be happy to assess you in that position. Also, if you notice that the end of the day is when you have the worst symptoms, it might even be helpful for you to schedule your appointment toward the end of the day. So that way your therapist can see if you have more laxity or more movement in those tissues than maybe you would if you came in first thing in the morning. Again, a lot of times women feel great whenever they first wake up, and then as the day progresses, the prolapse gets a little worse or a little more symptomatic. Now we'll talk about treatment. So what can we do in physical therapy? So the main thing that we are looking at is pressure management. That's probably the number one thing. And what I mean by pressure management is how you do with lifting and breathing, or with contracting your muscles and breathing. So we are wanting to minimize the amount of pressure that's going through your pelvic floor. So we can teach you how to safely move around and safely lift, and how to safely exercise to avoid worsening that prolapse. We will also work on strengthening or stretching whatever tissues need to be strengthened or stretched. Sometimes the pelvic floor comes in and it's not necessarily really weak. It's has some laxity to it, but it's also very tight in places. So it might have like what's called trigger points, or just really tight points in the muscle, because that pelvic floor is gripping all day to try to hold on, because it wants to avoid giving you those prolapse symptoms. So sometimes working on core stability and strengthening everything around the pelvic floor while we kind of release the pelvic floor can help with prolapse too. So everyone is different. It's important to have an individualized assessment. That way you really know what you need to work on. So it can definitely be helpful to find exercises like on YouTube, but sometimes you can do the wrong exercises and potentially make things worse. So I always recommend, if you are having these symptoms of pelvic heaviness, or just pelvic pain, or feeling like everything's going to fall out, I would recommend that you talk to a pelvic PT, or first be assessed by your OBGYN or your healthcare provider, so they can rule out more serious medical conditions. But you could definitely benefit from a pelvic health therapy evaluation after you've been cleared. Another thing that your physical therapist can help you do is come up with some conservative options for, external bracing. So I've got an example. This is called a V2 prolapse support, and it is actually worn over top of your underwear, but under your pants. And it just has a lot of nice padding here that helps support that perineum area. And it also has straps that kind of come around in the back. So this can really alleviate that feeling of everything falling out. This can be really great for women, and it's nothing internal that can irritate their vaginal tissues. So it can be good if you have a profession where you have to stand all day, or you have to do heavy lifting or something for your work. This can be an extra support system to try to help kind of counteract those pressures that are coming downward. They also make internal supports that kind of look like tampons. There's several different styles that are over the counter that you would be able to get to wear internally. And this might be good for someone who loves to run and they don't want to give up running, but they notice that they feel that heaviness every time they run. So in conjunction with physical therapy to strengthen and stretch what needs to be stretched, strengthen what needs to be strengthened, and activity modifications, an internal pelvic floor support can also be really helpful. Your OBGYN or your healthcare provider may also fit you for something called a pessary. So that is an internal support that actually holds that tissue up. And that could be a good alternative to a surgery. sometimes people do opt to have surgery whenever conservative measures fail, but I would always recommend that you start conservatively because you really have nothing to lose. And hopefully you'll gain better insight to your body and really learn how to successfully manage pressure, how to strengthen again where it needs to be strengthened, and really help you move and live the best life that you can. Thank you for watching. I hope that you found this information helpful. If you are having prolapse symptoms or feeling like everything's falling out or that heaviness, please reach out to a local physical therapist in your area. Pelvicrehab.com is a great place to go and search for pelvic health physical therapy, occupational therapy providers in your area. I'm located in the Bentonville, Arkansas area in the United States. You can also reach out to me with any questions and I can help guide you to a physical therapist that's in your region. Thank you so much for watching, and please like this video and subscribe to my channel to learn more.